Hello, and welcome to Group BD's evidence-based medicine presentation. Our question is, in women with urinary tract infection, is cranberry juice more effective in alleviating symptoms of UTI and preventing recurrent infections when compared to general antibiotics? So, to begin with, we have a little presentation on a female patient who is visiting her doctor for a regular checkup, and she has a history of UTI. Here we have Mrs. Stinson, a 35-year-old mother with a history of UTI. Mrs. Stinson was in her living room getting some work done when an interesting ad came up which got her excited.
Do you currently have a urinary tract infection? Are you tired of the constant pain when peeing or your pee smelling stronger than usual? Do you currently take medications and are looking for a more natural herbal option? If you answered yes to any of these questions, ask your doctor or pharmacist about taking cranberry juice instead. Cranberry juice contains A-type proanthocyanidins, also called PAC, which is said to inhibit bacteria from growing in the bladder. This chemical specifically prevents bacteria from sticking to the sides of the urinary tract, thereby preventing bacterial growth. Some research has shown that cranberry juice helps reduce the risk of recurrent UTI by over 26% and help improve the symptoms of a urinary tract infection. With daily doses of cranberry juice, you will resume living your life to the fullest. Pain and strong smelling pee will be a thing of the past.
During her next hospital visit with her GP, Dr. Moseby, Mrs. Stinson told him about the ad she watched on TV.
Hi, Dr. Moseby. Great to see you again.
Hello, Mrs. Stenson. How are you doing today?
I'm well. You know how I've been taking the trimethoprim combo all these years? I saw an ad yesterday about cranberries and how it can treat UTIs. I was hoping to get your insight as to having that as a natural alternative to what I'm taking now.
Oh, really? That's very interesting. I've actually never heard of that before. Do you mind if you give me a bit of time so I can go and do some more research on that?
Yeah, of course.
Okay, lovely. I'll get back to you in a few days.
No worries.
Dr. Moseby began his research by identifying his question, which he broke down using the PICO guide. So for the patient, we have women with urinary tract infections. For the intervention, it's cranberry juice, and which is being compared to general antibiotics, and the outcomes are alleviating symptoms of UTI and preventing recurrent infections. In summary, this guide helps us form our research question. In women with urinary tract infection, is cranberry juice more effective in alleviating symptoms of UTI and preventing recurrent infections when compared to general antibiotics? Dr. Moseby accessed the Royal Society of Medicine databases, specifically the Medline database, where he used UTI, cranber, and recurrent UTI as his search terms. He further narrowed his search by including only English articles, randomized control trials, and articles published between 2005 and 2021. After intense long research, Dr. Moseby finally found his focal article titled Cranberries vs. Antibiotics to Prevent Urinary Tract Infections by Dr. Beerpoot et al. In 2011.
He further did a critical appraisal of his focal article. With regards to the basic study design validity, the article did address a clearly focused research question. They also stated that the assignment of participants to interventions randomized was addressed. Yes, all of the participants who entered the study were accounted for at its conclusion. The authors analyzed the results using an intention to treat analysis to preserve randomization. With regards to the study methodology, all participants and researchers were blinded to the intervention by double dummy dosing. Additionally, the authors also ensured that the study groups were similar at the start of the trial by identifying specific baseline, demographic, and clinical characteristics. The different study groups all received the same level of care in the trial. Lastly, to interpret the results, all participants were ruled out based on an exclusion criteria, ensuring there were no ethical issues. The results identified that the drug was a better intervention. However, there was increased resistance rates for amoxicillin and trimethoprim in the TMP SMX group, but after discontinuation of the drug, the levels went back to normal.
Hello, Mr. Stenson. How are you doing today?
Good, thank you. How are you, Doctor?
I'm good, thank you. I've done some research on the question that you asked last time about cranberry juice, and I've actually found that there's no evidence to suggest that cranberry juice helps to prevent recurrent UTIs compared to taking trimethoprim. Can I ask why you take trimethoprim?
I'm not sure. I mean, since I was young, I've taken this medication for years as a child. I guess that's what they give to patients in Australia, so I thought I might continue it here. But
Of course, yeah. I've done a little bit of research, and for the NICE guidelines in the UK, it says that trimethoprim is a second line of antibiotics that you would take, and actually the first line would be ciprofloxacin. So maybe that's something we could try instead as an alternative and see how you get on with that.
sure, no, not a problem.
Okay, lovely. Nice to speak to you again.
No worries, Doctor. Thank you so much.
Overall, we learned that using the evidence-based medicine approach, cranberry juice or any other form of it, including fruits or supplements, is not an effective alternative for preventing and treating recurrent UTI when compared to general antibiotics, in this case, trimethoprim. However, according to the National Institute for Health and Care Excellence Guidelines, or NICE, trimethoprim is a second alternative for treating UTIs and is only used in cases where the first alternatives, including ciprofloxacin, pose intolerable complications.
Thank you very much for listening to Group BD's evidence-based medicine presentation. Do you have any questions?